of the total body surface area. The extent of the injury is going to be determined based on the temperature of the object and the duration of contact. Typically, these patients won't have metabolic derangements, but because these animals have fur all over their body, you may not see the burn injuries for 24 to 48 hours. They might have a hypersensitivity immediately, but they won't lose their hair and they won't have burn injuries initially. So the situations that I've seen are house fires, someone accidentally spilling boiling water on a pet, or electrical heating pads or electric hotter units. Also, I've seen a few muffler burns. So the animal's been under the car, or someone's dragging it out from under the car, and it stands up and it burns its back on the muffler, and everybody thinks the animal's fine, and then 24 hours later its hair starts falling out and its skin starts sloughing. So in a neurologically appropriate animal, to assess for local burn injury, I just rub my hand really lightly across their body in a kind of a systematic approach, and look for any twinging of their fur or their skin, because that will kind of help you localize where a burn injury might be. For severe burn injury, the patients are going to be burned more than 20 to 30% of their total body surface area, will have major systemic derangements, and these are the pets that are typically caught in house fires or car fires. Inhalation injury is seen typically associated with severe burn injury or alone. The sequelae from smoke inhalation goes from basically upper airway to lower airway. So within the first 24 hours in veterinary patients, we see acute upper airway obstruction and bronchospasm. So depending on how long the animal has been exposed and how much direct thermal damage has occurred to the upper airway, this is where I think it's important to understand the techniques that you can use to help this pet get to us, at least. These patients might require oxygen. They might require a little positive pressure ventilation with a mask. They might need to be intubated. I can't really say that that's something that you should do, but it's something that might need to happen if they have severe upper airway obstruction. Carbon monoxide toxicity also, occurs in animals, as you know. It's the extent of that injury is going to be directly related to the concentration of the inhaled carbon monoxide, the duration of exposure, and the underlying health of the patient. In veterinary medicine, there is delayed neurologic sequelae that happens if a patient presents comatose. Patients that present comatose are more likely to develop neurologic issues down the line. We typically see the neurologic issues happen around the 2-week mark. So there was a smoke inhalation dog puppy that was unconscious at the scene. Firefighters resuscitated the pet, gave it oxygen, and it came to me, recovered in oxygen over probably about 72 hours, and went home, and then 2 weeks later became aggressive. And the client was fearful of that, but that's something we have to warn these clients about. Typically, it's self-limiting. There's a handful of case reports of delayed neurologic symptoms in veterinary patients. Majority of it is kind of a dementia, deafness, or paresis or paralysis. It's self-limiting, and at 36, they said, month follow-up, the patients were all normal. And some of the patients were normal within 6 weeks. So it's just something, if you're communicating with someone and they're saying, I don't want to seek medical attention, it's just an important thing for them to understand that this isn't, just because your animal's up and moving, it's not over. So we also